You're listening to ABC Radio Melbourne.
Dr. Kiran Martin is in the studio because she's speaking at the Melbourne Press Club this week. She is the founder and driving force behind Asha. They do a lot. They're based in Delhi, but they do a lot to try to work in the slums in India. Thank you for joining us.
Thank you so much, Raf.
Tell me what Asha does. How do you try to help?
So there are about 16 million people living in the capital of India, Delhi, of which 4 million people live in shanty colonies. And you see them everywhere by railway tracks, right next to five-star hotels, all over rich neighborhoods. And so Asha's mission and Asha's vision is to bring about a transformation of the lives of people living in these shanty colonies. And I do that with the help of providing healthcare, and I have a huge work in the area of education and women's empowerment, financial inclusion, and development of infrastructure.
That sounds like you do a lot. So what, you bring in teachers, bring in doctors, bring in education around health. So you're doing... Where do you get all the people to do that?
So we've got a team, and then we also have a lot of volunteers that come in. So the healthcare program is driven by our own doctors and our own nurses. And
so do they work for free or are they paid?
They're paid, but we also have lots of volunteers. Community health volunteers, these are women from the slums whom I've trained to provide primary healthcare, and they lead the healthcare effort from the front because my philosophy and my ideology is that community members need to get empowered, and they need to provide leadership from the front in order for deep transformative change to take place. And because of the healthcare program that I'm running among 700,000 slum dwellers in the city, the infant mortality has fallen from 100 for every 1,000 live births to 16 for every 1,000 live births.
That's a big drop.
It's huge.
How long has Asha been happening?
Well, this is our 31st year. I started in the year 1988. I was a young pediatrician at the time, and I just had a suitcase full of medicines that had been donated to me by my peers and friends. And I went into a particular slum in the southern part of the city, and I just walked in, and I was horrified to see the living conditions there. Even though I come from a middle-income family myself, I had never really walked into a slum and gone deep inside before that, which is typical of what most people don't ever do.
Why did you do that in 98? What was driving you there?
I just felt like I was working in a public hospital, and I would find a lot of poor patients coming there, and I noticed that all the doctors almost were basically looking after either middle class Indians or extremely wealthy Indians, or they had their own private practices. And I knew that for this 4 million population there was hardly any access to healthcare. So I felt very driven and motivated to come to start working among these people. But it was not easy. It was really hard because I didn't realize that you have what you call the slum lords, and you have the slum mafia, and you have a very complex structure within slum communities. And of course, the infrastructure was very poor. When I first walked in, there was no water, there was no sanitation, and little kids were dying of unnecessary diseases like diarrheal illness, respiratory illness. So the whole philosophy of my program, which was to give healthcare into the hands of the people themselves and then support them with professional health services, worked wonders.
You mentioned slumlords and a slum mafia, so there's clearly people working against you, and it also sounds like something that is very difficult to do. Why do you keep going? Why didn't you give up? A lot of people would give up.
Yeah, in the beginning, when I first encountered the slum mafia, it was very disheartening because there are a lot of forces of exploitation and oppression in slum communities, and to keep the poor where they are and not let them be able to take their destiny in their own hands. I would look at the situation among the women and the children, and often the women would come and talk to me about the different, such huge difficulties that they would be facing in their daily lives. And there were times when I would feel that because the mafia was so powerful, maybe I won't be able to have any impact.
Were you scared?
I was. There were times when I was even given death threats, when they found that. So as long as I was providing basic healthcare, it was fine. But when I started helping women to get empowered, when I started helping women to approach the local political structures for clean water, for sanitary services, for land rights even, these are all really big ticket items. And so even while I had a philosophy of non-violence, violence and trying to be inclusive with the slumlords so that they don't feel alienated. I would invite them to all the meetings. But whatever I try to do, ultimately their bread and butter was being affected because their income came from exploitation. So it was really scary a lot of times. But then as time went on, I kind of just felt that I shouldn't give up, and things began to get better as women began to get empowered. It takes time to empower women, and they realized how important it was for them to be able to have a collective voice, and the whole slum began to change. So from a situation where I would be having to walk around mounds of garbage, the garbage got clean, new drains came in, there was plenty of water, there was in certain cases I was able to help along with the community to help them get actual titles to the land, because there were squatters and there was
because they might pay rent for decades but never end up owning.
Never. Exactly. And there was arbitrary demolitions and forced evictions,
Right.
So they were always scared of their the fact that they might one day become homeless. So these were all very, very difficult programs to do. And but what happens is that I found that as empowerment processes gather momentum, and as community members realize how much can happen through their collective action, by and by, slowly the power of the slumlords begins to get neutralized as they find their voices, and even the political systems and structures then begin to take more responsibility.
Kiran Martin is with us. She's the founder and driving force of Asha. She is speaking at an event at the Melbourne Press Club this week on Thursday. Just look up the Melbourne Press Club if you're interested. Do you think you're tough? You sound incredibly tough and resilient to me. Do you feel tough and resilient?
I think I'm very soft-hearted. You need compassion in order to be able to work in these communities. But at the same time, I'm tough too, and I wasn't as resilient when I first started, but because 31 years I've been going and I've seen a lot, things that are difficult don't faze me that easily as they
Clearly.
used to when I was younger. But there are still situations where I sometimes really have to fight it out because it's just so difficult.
And I know your government's just been re-elected. I think one of the things the Prime Minister pledged to do was put in 100 million toilets. I'm not sure if that was successful or not, but are the government in India doing enough?
I think that the current government has a lot of good intentions. This particular government that is currently in power has definitely good plans for the urban poor. So you have 120 million people living in urban poverty in India, and they have a certain healthcare program, a scheme for this entire population. They've got plans for education, and we've also had some.
So they're trying.
They are making efforts, but I think with regards to education, which is my big focus and emphasis at this point in time, we need to think about higher education. It's not enough to talk about primary education. This conversation around primary education has been going on for 20 years, that, we ought to have every single Indian child go to school. Now, that's a story of the past. If you really want to integrate the poor children into the mainstream and help them to find their place in society, then we need to talk about higher education.
Thank you so much for coming in. Really inspiring and really interesting to hear some of your story. Thanks a lot.
Thank you, Raf. Thank you.
Dr. Kiran Martin, she is the driving force. As you can hear, she sounds like a driving force behind Asha speaking at the Melbourne Press Club.